Hello there, my name is Ashley. I'm the nursing student that's going to be taking care of you today. How are you doing?
Good, how are you?
Good. What's your name?
Brooke.
Brooke. What's your last name?
Elliott.
And your date of birth?
November 5th, 1992.
Right patient. Perfect. All right. I'm going to go ahead and do a couple of assessments here. I'm going to ask you a whole bunch of questions and I'll go ahead and examine you, okay?
Okay.
My first question is, let's ask a little about you. What's your medical history?
I have asthma.
You do have asthma?
Yes.
Have you ever been hospitalized for this asthma?
Yes.
How long ago was your last hospitalization?
At least 7 years ago.
7 years ago. Have you ever had a tube down your throat to help you breathe?
No.
No, never got that far.
No.
Are you on any current medications for it?
Yeah, I take Advair, Singular, and an off-brand of Rhinocort nose spray.
Okay. Okay. And do you have any other history of any medical problems?
Not for me, no.
Any surgeries?
I had this wart removed.
A wart removal? Was it cut out?
Yes.
Okay. No, any like hypertension, diabetes, nothing like that?
My grandma on my mom and my dad's side both had diabetes, and then my grandma on my mom's side had lung cancer.
Lung cancer? Was that from smoking?
Yes.
Do you currently smoke?
No.
No? No history whatsoever?
Not for me.
How about drinking?
Occasionally.
Occasionally, like once every month?
A couple times a month.
Okay, so just like a social. All right, do you have any allergies to any medicines or any food allergies?
Nope, not that I'm aware of.
Okay. Do you have any allergies in general?
Yeah, I'm allergic to animals with fur and grass and all kinds of trees.
So all your seasonal allergies and asthma?
Yes.
Okay. All right. I'm going to go ahead and start a little bit about your orientation. I see that you're speaking to me nice and clear. I'm understanding everything you're saying. Your posture is nice and aligned. Good. And you're showing all your expressions through your face. You're very pleasant, cooperative, and calm. You don't have a flat affect or anything. You're nice and smiling. You're expressing all your emotions. I'm going to ask you a few more questions. It might sound ridiculous, but I have to ask them, okay?
Okay.
What is the current date today?
December 3rd, 2013.
Perfect. And where are we right now?
In Columbus, Ohio, in my townhouse.
Perfect. And who is the President of the United States?
Barack Obama.
Barack Obama. Perfect. All right. And how about, I want to get a better idea of how you do for eating. In your last 24 hours, what have you eaten?
I have eaten steak and baked potato and Wendy's and cream dried beef.
Okay. How about for your exercise?
I'm a dance major, so I dance about 6 days a week for at least an hour a day.
So you do about 30 minutes to an hour of exercise a day.
At least.
That's very good. All right, so we'll go ahead and get started more on your, how old are you? I'm sorry?
21.
21, okay. Guess I could have done the math myself. All right, we're going to go ahead and start on more of the examination process, okay? I'm going to start with your skin. Have you noticed any abnormal bleeding or bruising, cuts that you've gotten?
Not abnormal, most just from dancing.
Okay, I don't see any kind of birthmarks that you've had.
No.
Okay, I don't see any kind of scarring or any rashes, lesions. All clear. And you did say you have that scar right here in your left knee here, and you do have some ecchymosis here in both of your knees.
Yep.
Down here, you said you had a history of dance. I do see some calluses, some dried skin over here on your feet, and your dorsal aspect of your feet here. Same with both of these. Okay, so some just normal bruising and tearing here. You do have a piercing right here on your navel. I saw a few right here on your ears. Good. All right, we'll go ahead and start again more on your head. I'm going to focus a little over here. We're going to start out with a couple of your facial to see the symmetry in your ears. Nice and even. Your eyes are nice and even. Your nose is at midline. Have you noticed any, you said you had allergies, have you noticed any running of your nose, I don't see any current rhinorrhea right now. Nice and clear. Okay. In your eyes, I see that I don't see any kind of periorbital swelling. You do have contacts, I see. Good, but your sclera is nice and white. You do have a brown iris here. No signs of conjunctivitis or iritis. Your pupils are black and even right now. Good. All right. No strabismus or nystagmus that I've noticed right now. You don't have any history of any eye problems besides your
Vision.
normal contacts?
Yeah.
Okay. All right. I'm going to go ahead and focus on a little bit of your ears. I'm going to check you out here. I see on your outside here, I don't see any kind of swelling or redness. Nice and normal here. Good. Your exterior part of your ears are both good. I'm going to go ahead and look at the inside, okay? All right. Okay, I do see a mild amount of cerumen, but I do see your tympanic membrane. Nice and pearly gray back there. No signs of inflammation or erythema over there. Very good. I'm going to go ahead and come on this side. Over here, I don't see any kind of cerumen, nice and clear. Your tympanic membrane is also pearly gray. And no signs of erythema, drainage, or swelling. So your ears are pretty clear. For your right ear, you do have a little bit of cerumen. That's just pretty much earwax. Just a little washing it out. It'll be okay, all right? You can still see your ears, no abnormalities inside, okay? We'll go ahead and focus a little bit on your mouth. Do you have any denture history, no surgeries? So you had a wisdom teeth pulled out?
Yeah.
You did have those back?
Yeah.
Okay. So that is part of your dental surgeries, okay? Pass. I'll go ahead and have you stick your tongue out for me. Nice and wide. Say ah.
Ah.
Good. Your uvula raises at midline. Your tonsils are nice and good. No signs of inflammation. You have your soft and hard palate intact. Your buccal area is nice and moist. Same with your tongue. Tongue's at midline. So neck teeth are nice and white. No signs of any kind of badness. All right. Good with your tongue. Nice clean mouth you have there. Next, we're going to go ahead and focus on some of your cranial nerves. That's the nerves that are inside your brain. There's 12 of them. I'm going to test all of them. Starting with the first one, we go ahead and test your sense of smell. So what I'm going to have you do is close your eyes. Good. I'm going to open this up, and I'm going to go ahead and have you tell me what this smells like.
Alcohol.
Good. All right, you can go ahead and open your eyes. I'm going to go ahead and test your pupillary response right now, okay? Go ahead and have a look at me right here in your nose, my nose. Keep an eye out right here. I'm going to flash a little light at you, okay? Good. Other side. Good. Pupils are round and reactive, 3 millimeters bilaterally. I'm going to go ahead and do the same thing with your eyes. I'm just going to have you look at my finger here and only follow with your eyes. Good. The next thing here, we're going to make a couple of funny faces with your face, okay? You can go ahead and follow me. First thing is stick out your tongue again. Move it nice and around. Good motion with your tongue. Go ahead and stick back in. I'm going to have you puff up your cheeks. Good. Let that out. I'm going to have you go ahead and raise your eyebrows and squint your eyebrows. Good. Raise and squint. Very good. You can go ahead and stop there. All of your intact facial muscles there. I'm going to go ahead and have a test right here. Go ahead and clench your teeth nice and strong. Good strength bilaterally. Good. You can go ahead and let go there. I'm going to go ahead and test your hearing. Can you hear me over here?
Yes.
Can you hear me over here?
Yes.
Perfect. And can you hear me same right here?
Yes.
All right. Next thing is I'm going to have you go ahead and raise your hands like you're stopping traffic. Good. Hold it out nice and even. Good. Nope. Very good. I'll gotta have you lay down. Right here, I'm gonna touch your shoulders, and I'm gonna have you shrug against me, okay? Shrug, shrug, shrug. Good. And we're gonna, very good. All your cranial nerves are intact. It's a very good sign for you. I'm going to go ahead and move down to your neck. I see that your trachea right here is on midline, no deviations. We're going to go ahead and I'm going to go ahead and palpate around your neck right here, okay? For your thyroid. You have no goiter on inspection. No enlargement of your thyroid on palpitation here, okay? Very good. What I'm going to have you do is go ahead and we're going to test a little bit of your range of motion. Go ahead and move your neck all the way in a nice circular movement like this. Good. Did you feel any pain?
Nope.
Do you feel any pain or tightness?
Nope.
All right, good. I'm going to go ahead and feel around a little bit more for some of your sinuses, okay? Right here, do you feel anything?
Nope.
No pain?
No.
Good. How about right here?
Nope.
Good. Another couple more things I'm going to feel around for is your lymph nodes, okay? Right here, I'm going to have your hair moved back here, if you don't mind. First is kind of near your ears, right here in front. Preaurial, postaural. Good. Right here below your jaw. Right here below your chin. And right here behind your head. And one right here. Good. All your lymph nodes are really good size. There's no swelling that I've noticed through my inspection or my evaluation, okay? Next, we're going to go ahead and move down over to your breathing. I have kept track of your breathing. You're rating about 16. You have nice, even, and unlabored rate and depth. You're not using any of your abdomen muscles, just a nice, even pace, which is a very good sign. I'm going to go ahead and test for your chest expansion. Okay? What I'm going to have you do is go ahead and stand up over here. Go ahead and turn around facing the wall. Okay, so right here I'm going to have my hands down here. I'm going to have you take a deep breath. Good. One more time. Very good. Good chest expansion here. I'm looking at you right now and I'm seeing that you do have about a 2:1 ratio. And that's also very good for your width and length here of your chest. I'm going to go ahead and have you sit down. You don't have a barrow chest, which is signs of like a CO with signs of like COPD. Okay? Alright, so I'm going to go ahead and have a listen at all your lung sounds. Okay, you do say you have a history of asthma, so we'll check you out here. I'm going to have my hand right here. Nice deep breaths. Good, and right behind, okay? Very good. I didn't hear any wheezing, no ronchi, rales, or crackles. So all very good signs. With asthma, you hear a lot of wheezing. I don't hear any right now from you. Your respirations are nice and even, okay? Which are very good signs. I'm inspecting more of your heart system and your circulation. I see on your chest you have no heaves or lifts or pulsations. All very good signs. I'm going to go ahead and take a couple, listen here on your heart sounds, okay? I'm just going to listen right here. Good, your heart rate's about a 78 right now. I didn't hear any abnormal heart sounds. It's a nice even rhythm. No murmurs, okay? I'm gonna listen to a few of your other heart sounds. First one right here is your aortic. It's about your second intercostal space on your right hand side. Good, next is your pulmonic on your second intercostal space on your left hand side. Next is your Erb's point. That's about your third to fourth intercostal space on your left hand side. Good, down a little further. Sorry, I'm going to go down your breath here. Going to go to your tricuspid. It's about the fifth intercostal space down by your sternal area on the left side. Good. Your last one here is about on your left hand side, the fifth mid-clavicular line here. Good. That's where I'd hear your S1 sounds, which is your strongest part of your heart, on your apex. Okay. I'm looking over at your skin again. I see that it is appropriate for race. Your pigmentation is nice and white. Yeah, I don't see any uneven hair distributions or anything like that. You have a good capillary refill here, less than 3 seconds. Here, less than 3 seconds. I don't see any edema in your lower or upper extremities. I'm going to come down here a little bit, okay? Again, nice even hair distribution, good pigmentation, and is there any tenderness right here? No? Okay, I don't see any inflammation down here. Good. Can you feel me touching you right now?
Yep.
Good, on both sides?
Yep.
Can you go ahead and move your toes? Good. Perfect. All right. And good capillary refill right here. Good. Capillary refill, less than 3 seconds. While I'm down here, I'm going to go ahead and listen or feel for your pulses, okay?
Okay.
These are called your pedal pulses. Good pulses, even bilaterally and intact. I'm going to come up here. I'm going to go ahead and grab your wrist here. I'm going to check for your radial pulses. Good pulses. Good, even, and intact bilaterally. Alright, the next one we're going to go ahead and focus on is your stomach. I'm going to go ahead and have you for this exam. Go ahead and lay down, if you don't mind. On inspection, I see that your nice symmetry is good. You got no scars that I see, no past surgical scars, no stria or stretch marks. Perfect. You do got that piercing in your umbilicus. I'm going to go ahead and listen for your bowel sounds, okay? Just a little bit of cold here. Good active bowel sounds in all 4 quadrants. No hyper or hypoactivity. What I'm gonna do now is I'm gonna do a light touch and a little bit of a tap, okay? I'm just testing and seeing your organs and make sure they're not surfacing here. Good. No dullness present. I'm gonna go ahead and do a light little touch on all around your stomach here. You let me know if I'm hurting, okay? No pain? Nope. Good, one more here. And you still have your appendix and everything?
Yes.
Awesome, okay. This is gonna go a little bit deeper, okay? So again, let me know if I'm hurting you. I'm testing for any kind of enlargement in any of your stomach organs, okay? Very good. And no tenderness right here? Now let go. No rebound tenderness. All your organs are intact. I didn't feel any enlargements, okay? Alright, so what I'm going to have you do is go ahead and sit up for me. Okay, we're going to move on to the neuro system, kind of going back to that a little bit. I'm going to go ahead and test a couple of your reflexes, alright? First one I'm going to have you do is right here. I'm going to test your triceps. I'm going to have you kind of relax as much as you can. Feeling really relaxed? I'll move you around. Let me look. Okay, you're not relaxed. Try to relax completely. Good. Good. Over on this side. Nice and relaxed. Good. All right, so I'm going to go ahead and test your knees here. All right, you feeling nice and relaxed?
Mm-hmm.
You feeling nice and relaxed? There we go. Okay. Good. Again, nice and relaxed. Good. Reflex is intact there. Achilles. Good. Good. One test over here. I'm going to go ahead and have your feet again. Good. Negative Babinski. Negative Babinski. While I'm down here, my dear, we're going to test a little bit of your strengths, okay? What I'm going to have you do is push against me as hard as you can. Push, push, push. Very strong. Pull, pull, pull against. Good. All right, with your toes, can you go ahead and push on me like you're going on a gas pedal? Good. All right, now put up your deuce. Good. Push against me nice and tough. Good. Go ahead and pull. Good. Very strong bilaterally on both your upper and lower extremities. I'm going to test your grip string. Try not breaking my fingers with both hands. Squeeze my fingers nice and tight. Nice and tight. Very good. Good strength bilaterally there. All right, for right now, we're going to go ahead and test one more reflex. I'm going to call the gag reflex. It's probably the least favorite for most of my patients, but I'm going to go ahead and try yours, okay?
Okay.
Have you ever been tested for your gag reflex before? Do you have one present?
Yeah.
All right, go ahead and open your mouth nice and wide for me. Stick out your tongue. Good. Good gag reflex. All right. Now we're going to focus more on your like walking and your balance, okay? What I'm going to have you do is you can go ahead and stand up for me and have you stand right over here. What I'm going to have you do is go ahead and walk all the way to the side of the bed, turn around and walk back. All right, so your gait's nice and even. Good, no signs or symptoms of any kind of dizziness. Did you feel dizziness when you were walking?
Nope.
No lightheadedness?
Nope.
Good. We're going to go ahead and do a balance test. It's called the Romberg test. I'm going to have you stand right here in the middle. Feet together. Hands out. I'm going to have you close your eyes. Very good. I don't see any kind of swaying. Good even posture. No vibrations of your extremities. Just a couple more seconds. You're doing great. Good. You can go ahead and put your arms down to your side. You can go ahead and have a seat. All right. Let me find the trash over here. As far as my examination goes, my dear, you have a very good, you had a negative Romberg's test, which is good. All normal signs. Your exam as a whole has been pretty negative, which is also a very good sign. You're a very healthy individual, young, dancer. The only thing I would recommend for you is through the exam, you did say you have a history of diabetes on both sides of your family.
Yeah.
Now with diabetes, I'm going to go ahead and give you more information how to kind of plan out your diet. Do you want to be less on the carbs and simple carbs and sugar? That can also increase since you are at an increased risk for diabetes, okay? As far as that, everything else has been pure negative. Keep up on your asthma medications. Let us definitely know if there's any kind of problems, ongoing problems, then we'll go ahead and get you some more information about that, okay?
Okay.
All right. Again, my name is Ashley. It's very nice meeting you.
Nice to
The
meet
doctor
you.
will be ready in to see you, okay?
All right. Thanks
All right.
so much.
You let me know if you have any questions, okay?
All right. Thank you.
You're very welcome. You have a great day.
You too.